Lupus and GLP-1 medications, a brand new study from July 2026. Yes, we know GLP-1 medications are weight loss and diabetes drugs, and we know that GLP-1 drugs are primarily metabolic hormones. Their main targets are the GLP-1 receptors inside the body. The immune effects, they're considered secondary or downstream to the metabolic effects like weight loss and the reversal of diabetes. But they are also immune modulators, and I've been talking about this for months. They act directly on the immune system, and that is why it matters for lupus. So this was a review, not a randomized trial. Researchers pulled every published study on GLP-1 drugs in lupus and found 14 papers. Only 2 of them studied lupus patients who were actually taking these drugs. None were randomized controlled trials. This is an early map of the terrain, not a settled answer. They found is overall, it's favorable. People who have both lupus and type 2 diabetes, GLP-1 medications were linked to fewer cardiac events, lower kidney disease progression, and lower all-cause mortality. They also looked at a small series of 18 lupus patients who lost meaningful weight over several months with only one flare and no clear rise in disease activity. And yes, it was a very small study, but that's where we start with this kind of research. The immune system part, the immune modulator part, picture the immune system as a seesaw. One side sits the pro-inflammatory drivers like Th1 and Th17 cells, and on the other sit regulatory T cells, the Tregs, whose job it is to keep the inflammation in check. In lupus, the seesaw is tipped hard toward the inflammatory side, and what the mechanistic data suggests is that GLP-1 signaling can push it back towards balance, lowers pro-inflammatory cytokines, shifts macrophages towards the calmer M2 phenotype, and quiets the Th1 and Th17 effectors, props up Tregs while inhibiting NF-kappa beta, which is the master switch for inflammation. And this is important information. It does not happen through just eating better and exercising and losing weight. The puzzle is that if GLP-1 calms immune pathways in some people, why does it not do it in everyone? And what they found is it actually comes down to genetics, and the GLP-1 receptor signaling for some people is associated, not in a big percentage, but it is associated with higher lupus susceptibility. Honest read, it's promising for people with diabetes and lupus. It's biologically plausible as an immune modulator and no consistent signaling of disease worsening for the majority of the people that they looked at.